The Crossing is collaboration amongst a number of unions who are desperately concerned that our members who are having drug and mental health issues are unable to get treatment in good time, largely because the sector is overwhelmed by demand, and we're trying to do something about it. And we have come to the Victorian government, amongst others, to look for some seed funding to get that up and going. We think it's a really important project. When our members are suffering a mental health crisis, we often hear about it. We obviously don't always. And we feel quite frustrated in that it's very limited in what we can do to assist, other than refer them on to mental health specialists and or counselling. So this project gives us the opportunity to actually send people on to where they can directly get some medical treatment as required. It's really frustrating for any union official who, by our DNA, are keen to do things, to not just to sit back and watch others, but to get in and roll the sleeves up and do it ourselves. And when our members are going through a crisis, we want to be there with them and for them. And this is a vital piece of that puzzle. I think regulators, I think society more broadly, as well as mental health providers, have been overwhelmed by the amount of demand from people who are going through mental health issues, either in a crisis situation or even before that. And the cost, particularly in the private sector, of seeking adequate and comprehensive treatment is through the roof, even for those who've got private health insurance. We need to, and there are too many steps between when the person asks for help and seeks treatment and actually get that treatment. That's why we're keen to try and shorten that length of time that they take to get treatment, and to make it affordable for them as well. Having two long lockdowns in 2020 and 21 respectively, the challenges of working from home, although most of our members don't, they actually go to work, but that lack of social interaction, the social distancing and masks and the general fear around COVID engenders in people means that mental health issues and mental health crises are skyrocketing, quite frankly, amongst our members, as it is in the community more broadly, which is why we're so keen to help.